A new study confirms that elevated levels of carbon dioxide can play a surprising role in the longevity of the COVID-19 virus itself. These findings are as illuminating as they are concerning. This recent research was conducted by a team of aerosol scientists at the University of Bristol and found that higher carbon dioxide levels allow the virus to survive longer in microscopic droplets exhaled by infected individuals. Looking deeper into the study, scientists found that even moderate increases in carbon dioxide significantly raise the risk of disease transmission. This happens by affecting the pH dynamics of respiratory droplets. The experiments showed that as little as 800 parts per million of carbon dioxide can reduce the rate of viral decay. At higher concentrations, this led to a 10-fold increase in virus stability. But what does this mean in practical terms? Simply put, the impact of carbon dioxide levels on viral decay is significant. It suggests that reducing carbon dioxide levels could help decrease virus transmission. It's a clear call to action to prioritize ventilation and air quality when the COVID virus is suspected. This factor has not only been overlooked, but mandates that were put on people have apparently perpetuated the spread of the virus. Most people get COVID-19 by breathing in tiny droplets containing the SARS-CoV-2 virus from the air around them. However, these virus-filled droplets become less infectious over time because they become more alkaline or less acidic, according to Alan Hadrell, an aerosol scientist at the University of Bristol. The exhaled droplets become less infectious because they turn more alkaline after we breathe them out. I'm sure that few of you can forget the mask mandates during the height of the pandemic. In fact, some people are still wearing masks. Indeed, there are probably people who have been wearing masks for 4 years. Personally, I would walk out of a business if they required a mask because I knew that most of the masks were not effective in preventing the spread of SARS-2. But what was more important to me was all of the other things that the mask was holding in and causing to populate under the mask. I'm going to now ask you a couple of questions. Are there bacteria in my respiratory tract if I'm not sick? The answer is a resounding yes. In fact, the human respiratory tract is home to a diverse community of bacteria, collectively known as the respiratory microbiota or microbiome. The number of different bacterial species varies between individuals and depends on several factors including age, environment, health status, and lifestyle. But there are hundreds of different bacterial species that typically reside in the human respiratory tract. In normal conditions, there are more bacteria in the upper respiratory system, which consists of the area between the nostrils and the epiglottis where the trachea begins. Basically, the upper respiratory system is the head and neck. The lower respiratory system, which should usually have much fewer normal flora or bacteria, consists of the windpipe to the lungs and everything within them, right down to the little air sacs where gas exchange occurs. Next question, is wearing masks for an extended period of time a healthy thing to do? The answer is a definitive no. Wearing masks promotes the buildup of bacteria in the lower respiratory system for numerous reasons that I am going to explain to you, and then you can decide for yourself. So it's a biological fact that hundreds of bacteria live in our respiratory tract every day. It follows that wearing a mask for prolonged periods prevents the escape of these bacteria, and they proliferate and begin to migrate from the upper respiratory tract to the lower respiratory tract, eventually resulting in pneumonia in the lungs. So that you understand, these bacteria that normally live in us can become invasive. You may recognize a few of them: Staphylococcus, Corynebacterium, Moraxella, Propionibacterium, Streptococcus, especially Streptococcus pneumoniae, Neisseria, Haemophilus, Veillonella, Fusobacterium, and Pseudomonas. Anyone who works in medicine knows that some of these bacteria can cause pretty serious infections. So why do we have so many bacteria? Well, it turns out that these normal microbiota play an important role in protecting against pathogens, modulating immune responses, and maintaining respiratory health. So man is designed to live symbiotically with bacteria, but various factors can cause an imbalance that makes them invasive and harmful. Have you guessed what's going on yet? Several different factors cause bacteria and viruses to grow and spread down into the lungs because they can't get out through the mask. First, wearing the same mask without frequent cleaning harbors bacteria. Also, the masks create a warm and humid environment around the nose and mouth, which is the perfect environment for bacterial growth. Then you rebreathe exhaled air, which contains moisture and bacteria from the upper respiratory tract and the mask. This increases the bacterial load within the mask when you inhale, introducing even more bacteria into the lower respiratory tract. The impaired ventilation reduces the amount of air exchange, leading to a buildup of microorganisms. These things we have known from the start. Next question. Guess who else knew that extended use of masks would cause bacterial growth instead of prevent it? If you said Anthony Fauci, you're right. The October 2008 Journal of Infectious Diseases published an article co-authored by Anthony Fauci. The article is titled, "Predominant Role of Bacterial Pneumonia as a Cause of Death in Pandemic Influenza." There has been much debate about this article, with some saying that Fauci found that masks caused pneumonia, but Snopes and other controlled fact-finders immediately reported this as false, and it was because Fauci's report never actually said that. The paper does not make this conclusion, but anyone who reads the entire paper can see that it's quite obvious. You judge for yourself. The paper concluded that the majority of deaths in the 1918 to 1919 Spanish flu pandemic likely resulted directly from secondary bacterial pneumonia caused by common upper respiratory tract bacteria. They also found that deaths were virtually never caused by the etiologic agent itself, but directly by severe secondary pneumonia caused by well-known pneumopathogens that colonize the upper respiratory tract. The article goes on to say that without the secondary bacterial pneumonia, most of the patients would have recovered. That pretty much says it all. You should also know that masks were mandated during the 1918 pandemic. So I took it a little further and learned that the pandemic prior to the Spanish flu of 1918 was the Russian flu from 1889 to 1890. There was a much lower death rate from this pandemic. Are you listening? There were no mask mandates during the Russian flu pandemic. There's one last kick to this thing, which takes us full circle to the recent findings regarding CO2, extending the virility of the COVID SARS-2 virus. This emphasizes the importance of good ventilation and air quality in our indoor spaces, as well as the need for further research. It's a fresh perspective on the fight against the virus, one that reminds us of the complex interplay between our environment and our health. Remember, the science is ever evolving, and as we continue to learn and adapt, we stand a better chance of overcoming this global challenge. So keep an open mind, stay informed, and let's continue to support the ongoing scientific research that is guiding us through these unprecedented times. To recap, we learned that a new study was just released confirming that higher CO2 level prolonged the life of COVID SARS-2 droplets. Last question, does wearing masks concentrate CO2 in the mask? I'm thinking that most of you have gotten it by now. If a person is wearing a mask and CO2 levels build up inside the mask, it can affect the SARS-CoV-2 droplets exhaled into the mask. When you exhale, you breathe out CO2, which can be toxic if it accumulates. If you're wearing a mask, this CO2 does accumulate inside the mask. Higher CO2 levels can prolong the survival time of the exhaled droplets. In conclusion, wearing a mask can lead to a buildup of CO2, which can make exhaled droplets more acidic. As discussed earlier, this acidity extends the survival of the virus in these droplets. When we are talking about respiratory infections, ventilation is critical. People are 4 more times likely to become infected in a poorly ventilated room. When we align ourselves with the miracle of the human body, we intuitively understand the restorative design of the body. Yes, there are bacteria that live in our respiratory system. They protect us, kind of like how spiders eat bugs in your home. But we were also given lungs, and all health principles should include breathing techniques. This is the ventilation required to keep our respiratory flora in balance. So breathe. I hope this video has given you an understanding of the importance of ventilating your lungs with fresh air, and has also made you understand that for many reasons, masks made the problem worse. They likely killed many people. The only people who should wear masks are the same today as they were 10 years ago. Only people with compromised immunity should wear masks, and then only in crowds or high-risk places. If you like what I do, share my videos and subscribe to my channel. I always appreciate your time and your comments. Until next time, open your eyes to what is going on in our world.